Let me thank all of you for your opening statements. We're now going to turn to the question and answer portion from the members, and I will start with my own questions here. I'm going to start with you, Ms. Webb. Thank you for your opening statement. You discussed how the one-on-one guidance you received from the Royals program, how helpful that was and taught you certain life skills. You also highlighted the differences between providing support for younger children in foster care compared to unique needs of older youth. My question for you is, in your view, is there the need to have specialized case managers dedicated to supporting older foster youth who will be exiting foster care? If so, what difference would this make in their transition to adulthood?
Yes, there does need to be specialized case managers, as specialized case managers helps transition the youth to adulthood through focus on themselves instead of worrying about younger kids, as well as they're just focusing on the older youth. And through communication brings trust.
Thank you for that. Mr. Nelson, I'm going to turn to you next. You shared how you and your siblings were unaware of the resources available to you while you were in foster care and the impact that had on you. What do you think is the most effective way to raise awareness among foster youth services on the services available through SHAFE, such as education and training vouchers, especially knowing that some states are returning these unused funds?
Absolutely. Thank you for the question. So for myself, I think that letting people know through the duration of meeting when people, like when a caseworker sees you, for example, letting them know that this opportunity to exist. When we go to court, let them know this opportunity to exist. So you're hearing it repeatedly. Part of the reason why I spent 6.5 years at a community college prior to transferring to Temple is because I didn't think that I can afford college. And I didn't have the means, of course, because I'm a first generation graduate and, student, of course. So I would say this, constantly reminding people about just the opportunities that's for them, because my little brother actually too, he didn't even pursue college because he didn't think it was for him as well. So that played a pivotal role in my development from 17 until when I got to foster club, and I started finding out about this at foster club through an 8-week course or 8-week externship. Then in my entire 7 years in the foster care system.
Thank you for sharing that. That's helpful. Dr. Stevens, I'll turn to you next. Ms. Webb emphasized the need for specialized case management for older youth in foster care and how that one-on-one guidance provided to youth through the Royals program should be standard. Based on your understanding of the SHAFE statute, can states utilize SHAFE funds to provide specialized case management to the older foster youth, and do you think SHAFE should be amended to do so?
Thank you for the question. I think that the way the policy is written, the way I understand it, is that it can be used for a multitude of services for older foster youth, including support through case management. I think there's a lot of confusion amongst the states as I talk to different state administrators and federal policy analysts on this, because it's not explicitly stated that this is allowed. So there are certain items within the CHAFE legislation, training of foster parents, training of case managers that are allowed. And so depending on how you interpret it, because it's not explicitly stated, some states tend to say, well, then no, we can't do that, while other states lean towards allowing those things. Whether or not I think it needs to say that or be more clear in policy, 100%. I think CHAFE funds should be used to support young people in their work and pay for case management. As you heard here, and we could recount hundreds of stories again, it's the people. Yes, the dollars help, but it's really the people and the supporters that help our young people move into adulthood successfully.
Thank you. Ms. Goulet, I'm going to turn to you next. Federal data finds that in 2021, at least 34% of former foster youth experienced homelessness, and I highlighted that in my opening statement. HUD's foster youth to independence vouchers are intended to help former foster youth avoid homelessness. Last month, HUD announced 39 of these vouchers worth more than $345,000 for the Peoria Housing Authority in my district. Can you talk about some of the disconnects that exist at the local level or barriers to ensuring these HUD resources are connected to Chafee youth? And what role can Congress play in encouraging public housing authorities and child welfare agencies to coordinate better?
Thank you for the question. And first of all, congratulations on bringing those vouchers to Peoria. FYI has been an absolute life-saving resource for youth in Rhode Island. And what it took to get there was our child welfare agency needed to provide or secure supportive services and work in tandem with the housing authority to issue and maintain the vouchers. Since Chafee funds end at 21 in some states and 23 in others, and the vouchers can go right up until a young person has turned 25, there was a reluctance to sign on for the supportive services. We turned as a private provider in the community and said, we will say that we'll provide those supportive services. Foster Forward will sign up. And we went out to the private community and found CVS Health and Blue Cross Blue Shield of Rhode Island to help us fund the cost of the supportive services. And that gave the push that we needed to bring the vouchers into our state. The last part of the stool, you could look at a three-legged stool of bringing in the vouchers, providing great supportive services, which we're doing with Works Wonders and the other programs that we provide. The third piece, though, is you need affordable housing stock. And we went out to market to buy it and rent directly to young people leaving. I think what Congress can do is continue to lift up these stories of success, find similar organizations in the communities across our country, and really leverage community resources to pay for high-quality supportive services.
Very helpful. Thank you.